her words, a reminder that this pandemic hasn't just taken lives, it's left hundreds of thousands of people dealing with enormous loss.
Every time we read those numbers, you have to realize that is somebody that a family member loved dearly and lost, right? One psychotherapist using the loss of his grandfather to the virus to remind others how to take care of their mental health during this time. So joining us now is psychotherapist, New York Times bestselling author, Dr. Mike Dow. Good morning to you, doctor. Good morning to you.
Good morning. Thank you for having me.
First and foremost, very sorry for the loss of your grandfather during such a difficult time. Can't even imagine what you guys were going through. But I think it's easy, right, to think that mental health professionals are immune to struggling with mental health. What came up for you as you dealt with the death of your grandfather?
Just so many things. And I think we're all struggling with so many difficult and complex emotions. So for me, it was deep sadness, but also anger. He just passed away last weekend. He lived in a senior community where there was this outbreak, and all of a sudden I was that statistic. So, I think for all of us, it's so easy to separate ourselves somewhat. And, we do the things, we wear our masks, we social distance. But then when it's your family, your grandfather, your mother, your father, your son, your daughter, your aunt, your uncle, it really hits close to home. And it just is a reminder also of how precious this life is.
Right.
It also kind of makes you feel helpless, right? Because this is your grandfather. You had no control over protecting him from this. He got it in a way that you never expected, and now he's gone. There's a lot of anger that comes with grief. How are you managing through that, and how do you suggest others do that?
So, I'm really focusing on all of the positives as best I can. There is this part of me that's just so deeply angry and saddened that we couldn't be with him because of COVID in his final days and hours when he was admitted to the hospital. And yet 90 plus years of a beautiful life. So I am trying to every single day remember that the love and the gratitude that he taught me is still here. He was just so proud of me, and he taught me so much, and I am missing him dearly. And also the funerals are hard right now. So my family and I decided not to do a funeral. We are going to travel to Ohio, across the country. I'm in Los Angeles. He was in Las Vegas near my mother. And we're going to bury his ashes near my grandmother, next to my grandmother. And that's hard too, because I often say that funerals are mostly for the living. And, so all of us are grieving, do it with some Zoom calls and some FaceTimes, but it's just, there's something about that interpersonal, face-to-face time with people that we love that just is so healing that we can't.
And so I want to talk to you about using some of that sadness, some of that depression as a bit of jet fuel, as you call it. What do you mean by that?
So, I believe that feelings are information, and we don't want to ignore our feelings, but we also want to heed them. I believe that depression is speaking to us, it's trying to tell you something. So if you are feeling depressed like I was all week, that was the indication, wow, I really need to up my self-care game. I really need to take a walk. I need to take my dogs to the dog park. I need to do something right now because I'm feeling just so low, so angry, so sad, so many feelings coming up for me. I need to reach out. I need to FaceTime. So if we use our feelings as information, as jet fuel, it can actually help us to make ourselves better so that we can take really good care of ourselves.
Advice right there.
Yeah, it's very important in turning that tide, because it can either take you down or it can propel you, and you say let it propel you. Dr. Dow, thank you so much for your time. And again, we are so sorry for your loss.
Thank you so much. Thanks for having me.
Great other tips of cognitive behavioral therapy and replacement therapy. We'll have those, and check his website out and books as well for some of those great tips. In the meantime, though, it is 9:35.